Good morning, everyone. I am Megan Rogers with SHIP, and I am joined with my co-hostess, Melanie Garland, who's also with SHIP. I'm in Northern Indiana, and she's in Southern Indiana. And we are here to talk about some Medicare mail that you will start getting a little bit more than normal because open enrollment is coming. So we're going to talk to you about what you should keep, what you should toss, what's important, what isn't important. And this is our last Facebook Monday of October. And when we get to the end, we'll talk about our plans for the rest of the year with our Facebook Lives. But I am going to turn it over to Melanie, and she's going to get us started with our Medicare mail conversation.
All right. Thank you, Megan, and good morning to everybody. And yes, we are in the first couple of weeks of the open enrollment period. So we thought that it would be a good time to talk about mail. So you may be tired of going to your mailbox and seeing all of the mail that arrives in there. And so our goal today is to let you know the items that you need to keep, items that you can toss, and items that you may want to shred so that your personal information isn't shared, just to protect that personal info that you may not want others to see. So we are going to start off with some mail that you will receive when you're new to Medicare, but we're also going to talk about mail that you're probably already got towards the end of September, beginning of this month, and may still continue to get throughout the open enrollment period. But let's first start with what we're going to talk about today. So we're going to start talking about the Medicare mail that you will receive when you're new to Medicare, whether you're auto-enrolled or not auto-enrolled. Notices that all Medicare beneficiaries get, and notices that you may get, and depending on the situation or things that you have done with Medicare, some notices that you can expect. And then we're also going to talk about notices from Medicare, about certain accounts, summary notices, and income monthly adjustment amounts. So we're going to go ahead and dive right in with getting started with Medicare. So if you are automatically enrolled in Medicare, you will get a Welcome to Medicare package. This is the first mail from Medicare that you will get. It includes a letter, a booklet, and most importantly, that Medicare card. The booklet explains important decisions you need to make before your Medicare coverage starts. So you'll also receive a reminder letter about decisions that you can make before your coverage starts. And you will get your welcome package 3 months before your Medicare starts. And you'll get that reminder letter 1 month before Medicare starts. So those are things that you want to keep when we're talking about our Medicare mail. Now we're going to move on to, if you're not automatically enrolled, you're going to get certain similar mail from Medicare. But what is a little different is that mail will come out to you after you have enrolled. So you'll get that about 2 weeks after you sign up for Medicare or Social Security benefits. So it's going to be the same Welcome to Medicare package that you would get if you're automatically enrolled. But you won't get that reminder letter necessarily because you enrolled yourself. So you already remembered. And then you will be able to know about those extra plans and things that you can sign up for. All right. So then just a quick reminder, when you are initially signing up for Medicare, you do that through the Social Security Administration. So you can go online to do that. You can set up an appointment by calling for a phone appointment or even an in-person appointment. And then you will get your information after you have enrolled through Social Security. You'll get your Welcome to Medicare package. Okay, Megan, I'm going to turn it over to you.
All right, thank you, Melanie. So now we're going to talk about some mail that all Medicare beneficiaries are going to receive at some point in your time of having Medicare. So every year you should get an updated Medicare and You handbook. Usually it comes out late September, sometimes early October, depending on how the mail is moving. My dad did get his already. And it's going to include a summary of the Medicare benefits, rights, and protections. And so it'll have the same standard information on the different parts of Medicare. Most of the book is the same from year to year, but they will include updates that are coming to Medicare in the following year. So you'll want to make sure you look for those. And I believe they usually put those at the beginning of the book, or at least give a summary of those new changes at the beginning. And then in the back of the book, it's going to give a list of available health and drug plans, so your Advantage plans and your standalone Part D plans. And then it's got a list of frequently asked questions. So it's a great book to keep, to refer to if you have questions throughout the year, or to look to see what's changing in the coming year. Then there's plan marketing materials. So usually the beginning of October, you're going to get all kinds of brochures, flyers, and other packets from the insurance companies out there, drug plans, Advantage plans, even supplements. Usually most of this you can just toss or shred depending on what information of yours is listed on the mail. So that's just ways to get you to come to the plan. You know, they want to try to entice you to change your plan. You may want to look at it, but depending if you have an agent or if you go to a SHIP counselor, you can just work with them and you can just pitch these marketing materials. Then we have our replacement Medicare card. So if you ever lose your Medicare card, or you know your name changes for some reason, or you are going, maybe your Medicare number got compromised, which we're going to talk more about towards the end of the presentation, and you have a new Medicare number, then you would get a replacement card. So you're going to be the one requesting it or asking someone to request it. If you get one and you didn't request it, that could mean that your number was compromised through your medical provider's office or a hospital that you've gone to. And you can call Medicare to confirm that that's legitimate, that they triggered that card being sent to you. Or you may have already gotten a letter from Medicare telling you that, hey, your number got compromised and we'll be sending you a new card. But again, you can always call Medicare if you are wondering why you got a card. All right, next slide. Melanie, please. All right. So these are some things that some Medicare beneficiaries will get from time to time. So some individuals might be picked to do a survey from CMS, Centers for Medicare and Medicaid Services. So it's a survey that they want to ask you how you feel that your health care is going, talking about the insurance that you have, the rising cost of health care. So if you do get selected for that survey, it's usually going to come in the late summer time. And if you question if that's a legitimate survey, again, you can call Medicare and ask them. Some Medicare beneficiaries are going to get a Medicare premium bill. So if you are not getting Social Security income of any kind while you are on Medicare, then you will get a premium bill from Social Security to pay your Part A, Part B, and or your IRMA quarterly. So you'll pay all of that 3 months at a time. Most people don't pay for Part A, so it may just be Part B that you're getting the bill for, but regardless of what premiums you're paying, it will be quarterly, so you will have to pay those 3 months at a time. And then some other notices that you might get are qualifying health care notice and IRS form, and Social Security benefit rate change notice. So being alerted to what your Social Security benefits are going up to and what your premiums for next year are going to be. All right, some other notices are the secure Medicare online account. So if you have a My Medicare account at medicare.gov, then you will get a letter that you set that account up, or if you had to reset your password, if you closed the account, if you restarted the account. You may get some of these through the email, or you could get snail mail. It depends. My dad has an account which I control, and I get all of his notice through email. but some people might get it through snail mail. So every time you do something new with that account, you will get mail to confirm that it really is you doing that and not someone who hacked your account. Then there's the Medicare summary notice. This is quarterly, and this is about all of your services that Part A and Part B were billed. So if you went to the doctor, if you went to the hospital, those claims are going to be in this Medicare summary notice. It's not a bill, but it's a very important thing to look at because you want to make sure that Medicare is being billed for services that you actually had done and that are correct. So, example, my grandmother went to the hospital several years ago, and I looked at her Medicare summary notice. She was at the hospital those dates, but it said she was in the ICU. She was never in the ICU. So we called to get that corrected because there's a price difference between a regular room and an ICU room. So again, important things to look at to make sure that nothing fraudulent is happening. And then you've got your income related monthly adjustment, income related monthly amount adjustment, IRMA. It's a mouthful. So this is if you have to pay a higher premium for your Part B and or your Part D because your income for the year was high. I think it's over like 100 and some thousand now. If it's over that amount, you may have to pay a higher premium. So you're going to get that determination letter from Social Security. You're going to get your annual notice of any changes from year to year. And you can appeal this too if your income is not that high anymore, because Social Security does look at this amount for your income 2 years prior. And if you have questions about that, you can reach out to SHIP and we'd be happy to help you talk about that to see if it's appropriate or if you can appeal. So Melanie, I'm going to turn it over to you to talk about what people may get from their health and drug plans.
Absolutely. So this is the time that you're going to be getting some of these mails. So thank you, Megan, for going over some of the other items that you may get. So Medicare beneficiaries that are currently receiving Medicare Advantage plans or a Medicare prescription drug plan, you are going to get notices about your plans and any changes that they're going to make for the upcoming year. And we think that it is especially important this year to really look at those plan documents that you are receiving because it can have certain information on them about some changes that the plans are going to make for the following year. So you will receive an evidence of coverage. This is going to let you know what the plan covers, how much you pay, and more information as well. You're also going to get a plan annual notice of change, and that should have already arrived to your doorstep. It comes out towards the end of September or beginning of October. This is going to go over any change in coverage, costs, or service area that's going to take effect at the beginning of next year. So this could be premium amount changes, medication coverage changes. This could be copays, coinsurance changes, and also provider network changes. Your plan will also have to let you know if they're leaving the Medicare program. So if your Medicare Advantage plan or drug plan is no longer provided next year, you will get a plan non-renewal notice. Now, the notice of credible coverage. So this is going to be something that you will receive if you receive credible coverage outside of Medicare. So this could be from a health plan or a health plan provided through an employer or a union or retirement benefits, and they will let you know that your plan is still credible. And what that means is it's as good or better than Medicare coverage, and it qualifies you to not have to have a Medicare plan. And then if you did in the future, you wouldn't have a penalty because you did have that credible coverage. So that will come from your private insurance coverage, whether you received that through union, employment, to let you know that you do have credible coverage. Okay, so Medicare and extra help. So these notices are going out. I actually just had a client send me an email that he received his notice of extra help this year. So I think they're coming out in the mail anytime that you'll receive those. So you will receive, if you are currently on extra help, you're going to receive your deemed status notice and notices of any change in the extra help co-payments for next year. And when you are newly eligible or automatically enrolled in extra help, you will get this from, and Megan, correct me if I'm wrong here, but I think it comes from the Consumer Health Care and Benefits. It may not necessarily say Social Security Administration on that envelope.
That sounds vaguely familiar.
Okay. Yes. So just making sure that you see that federal government stamp on there, but you will get a deemed status notice. If you're automatically enrolled in extra help, you will get a notice of that. And you will also get a notice of auto enrollment if it went retroactive. Okay. Now, other notices of changes that will come out for your extra help, which is coming out now, is a change in those co-payments. Okay, so that every year the co-payments for your level of extra help can fluctuate, and unfortunately, they usually go in the direction of up. So we did get that verification earlier this week that the extra help copays did go up a little bit. So don't be surprised if you notice that. And then you will also get a Social Security notice to review eligibility for extra help. So one of the emails I received from our client, and he knew this was coming, is that his extra help continued throughout the year, throughout the end of the year, but he knew he was no longer eligible for it. So he got a notice that he was not eligible anymore. So you will get those notices. Other things that you can expect is there's a lot of outreach going on from CMS about low income subsidies available and the Medicare Savings Program. These are going out in May and November. So if you get one in November, that's what it is. It's just from CMS, making sure that you know that it exists. And if you think that you may be eligible, I know a program that can help you apply. So you can meet with a SHIP counselor or contact SHIP, and we can at least tell you what it is, what the eligibility is, and then if you are interested, we can help you apply as well. Other information regarding Medicare Savings Program and extra help that's available for Medicare drug coverage. So you may get some notices on that throughout the year as well. All right. So marketing organization. So you are going to get lots of mail this time of year, like Megan previously mentioned. And a lot of it is just going to be mailers that they're receiving, that you're going to be receiving during the open enrollment period. You will also get these when you're new to Medicare. So we have a lot of clients that come and meet with us when they're new to Medicare, or even before they've started Medicare, or even if they're not starting Medicare, but they're Medicare age. You are receiving advertisements and mailers from companies that is trying to get your business. And that's really all that it is. So like Megan said, you can cross your name off, tear your name off of there, put that in the shredder, and then toss the rest of it. Or, and as you toss it, you can toss it into your recycling bin. So, but most of the time, these are going to be advertisements. You do not need to keep or respond to these mailers. If you're not sure what to do with it, or it does seem like it's something important, give us a call or call 1-800-Medicare, and we can review that document with you just to make sure you're not missing anything important, and to also make sure that you're not responding to something that you don't want to respond to. We are going to talk more about some scams and things that go on with mailers as well. Okay, so keep in mind, majority of mail coming from insurance companies, it's happening now, the end of September, and even late through this month in October. And it's just enticements. They want you to join their plan, and they want to tell you all about the different offerings that they're offering. But we encourage you to not sign up for a plan directly through those mailed advertisements, because it usually is for one company or even one specific plan. So you're not able to see all of the other options that's available to you for drug plans and advantage plans in your area. So the best way to see all of your options is to shop around for those. And so SHIP counselors, we can help you do that. We use Medicare.gov. It is the only federal website used for Medicare information. So it's not tied to any insurance companies or brokers. All plans are required to have their information on that website. So get on there, play around. We have a couple tutorial videos on our Facebook page about using the Medicare.gov plan finder. And you can also meet with a SHIP counselor that can help you navigate that. Okay, Megan, let's tag team this one here. So, how do we know
Okay.
if it's junk mail? How do we know if it's a scam? If the mailer asks you for important personal information like your
Mhm.
credit card number or your social security number, well, number one, don't respond, don't fill it out, and it's probably junk.
Exactly.
What else do we know if it's junk, Megan?
So if the mailer throws around words like free, it's most likely junk as well.
Yep. If they have colorful graphics that may or may not look like the Medicare card and says things like open me or you need part C if you don't have part C or you need this or you need that, it's going to be an aggressive sale tactic. But again, that's all it is it's just a sales tactic. And if you want to make sure that you have the coverage and the benefits that you need, talk to a SHIP counselor, call 1-800-Medicare. If you have a trusted insurance agent, you can talk to them too. Anybody that you trust that knows about your coverage, but don't call the number on those items because usually it is an enticement. I will give one example. I was just at a health fair yesterday, and the lady that came up to me, she was wondering about Medicare savings programs. Well, Medicare savings programs is a federal form, of Medicaid that can help pay for some of your Medicare out-of-pocket costs. Well, this mailer wanted her social security number, her
Mm,
date of birth, her Medicare card number, her address, and wanted all of this information so that they could help her apply for a Medicare savings program. And at the bottom of it, it did have in very fine print that it came from an insurance company and not all plans are available in their area. And it even had, Megan, if you want impartial resource and information, contact your local SHIP program.
ooh.
So all of those things are required to be on those mailers,
Hmm.
but
Yep.
I don't think there's a requirement for font size. So you might have to look really close and
Hmm.
really hard at the fine print to see those things. But this woman, if she would have filled this out, she would have given that insurance company specific information about her. And what they decide or choose to do with that information, we don't know. So, to protect that information and to make sure that you're not signing up for any plans that you don't want or giving out your information to people that you don't want to have it, don't fill out any of those forms. Toss them,
Exactly.
throw them away. If they have your personal information on them, put them in the shred. Before, if you don't have a shredder, local libraries usually
Hmm.
do. Local social service agencies can usually take care of that for you
Hmm.
as well. Um, your SHIP counselor can look over that and make sure that that is truly junk. But what the good news was is this lady did qualify for a Medicare savings program.
Wonderful.
I know, and we were able to help her fill out that application without giving her information to anybody that was soliciting it. So we kept her protected that way.
That's
All right.
wonderful.
Yes. Okay, Megan. Well, tell us more about what may be junk mail.
Another thing that might be junk mail is the pre-sorted or pre-sorted standard in like postcards or envelopes, even. You look and see it in the postage area. Most likely that is junk. Now, I will say that I did see one with the pre-sorted, and it was from CMS, Centers for Medicare and Medicaid Services. Now, that was not junk. So, what I would recommend is if you do see pre-sorted, look very hard on who sent that. Social Security, Medicaid, so FSSA, or Centers for Medicare, Medicaid Services. Those would be things to really look at because those are probably legitimate mailings. But if you can't tell who it's from, again, like Melanie said, you look really, really hard at the fine print. You get your readers out, your magnifying glass, and see if it came from an insurance company. If you really can't tell who it's from, that's another trigger that it's junk mail and that you can shred it or pitch it, whatever you're comfortable with, black out your address and everything and don't respond to it. So, Melanie, what's another way to know if it's junk mail or a scam?
Yes, absolutely. And one more thing about that pre-sorted,
Mhm.
usually that's just your clue that it was a mass mailing. So it went to multiple people.
Mhm.
Um, Now if the mailer, and we get this all the time, and it's usually from like a cable company, but it's like that fake handwriting that you could see on it, like it looks like it's personally written to
Mhm.
you. It's probably not. It's probably still a mass mailing. It's probably still not from a live person. And once you open that envelope, you'll see an advertisement in it, most likely. Okay, well, we do know that it happens. Identity theft and fraud happens, and sometimes we do respond to those mailers, or we answer the phone call and we give out certain information. So if you feel like your Medicare number has been compromised, call 1-800-Medicare and report that. They need to know that. You can also contact Social Security if it's your Social Security number that got compromised, or go to identitytheft.gov to report that. And the Senior Medicare Patrol, they are one of our partner agencies, and they are such a great resource. They can walk you through if you thought you were a victim of fraud or a scam or identity theft. They can walk you through what steps to take, how to report that. They are through the Inspector General's office, so they can really help you walk through those steps and make sure that you are protecting your information, especially if it was compromised. So they get on and do some reports and Facebook Lives with us from time to time, and they're just such a valuable resource. So we really love our friends over at the Senior Medicare Patrol. And one of the things, Megan, you talked about your grandma's, evidence of coverage and that EOB that she got, and that's another way that you can catch fraud, and you can
Yep.
catch inaccurate billing. And if you were billed for something that you did not receive, that's your clue that your Medicare number has been compromised. So you really need to report that and get a new number, and also get Senior Medicare Patrol involved as well, because they can help report and make sure that that got caught. So, okay, Megan, I'm going to let you wrap us up.
Wonderful. So we've got some resources here. So if you want to meet with a SHIP counselor, to either go over some of the mail that you're getting, you don't know what to do with it, to review your plans, or you just have other questions, you can call us at 1-800-452-4800. Our website is listed. You can go there to find local partner agencies that you can contact for your county or your city. And then we have general Medicare resources, so 1-800-Medicare. As Susan likes to say, it's one letter too long, so it's actually 1-800-Medicare. So you can give them a call, Medicare.gov as well. We've got the Social Security Administration number. I'm assuming that's the national number, so if you wanted to, you can always Google the local office as well for your city or county. And then SSA.gov, you can also go to apply for your Medicare, apply for extra help, or get help with some of your other questions that you may have. All right, so what is coming up for our Facebook Live? So we are taking a pause in November because Susan, Melanie, and I are just going to be a tad busy meeting with all of you to go over your Medicare options for 2025 and helping out our local sites and our local counselors. So you will see updates from us on Facebook throughout the month, but we will not have any videos going. But we will be back in December to at least talk about what's coming to Medicare that's new. So we'll have that schedule up soon. And then we will be back full force in 2025 every month as well. So thank you all for tuning in. If you have questions, please, continue to chat those in the comments, and we check those from time to time. So Melanie, thank you for the great information, and we will see everyone in December.
Absolutely. See you in December. Thanks for watching.